Welcome back, everyone. You know me, Greg Essenmacher. I am super excited. Why? Because I love when guests of mine and friends of mine refer somebody else to come to the program. And so today, I am really excited to introduce a new friend of mine, Jessica Martin. Jessica Martin is a licensed school psychologist and a dental practice co owner. Jessica helps private practice, practicing something. She's probably perfected something, actually. She helps private practice healthcare professionals. You purposely put that in there to see if I could do a tongue twister. Okay, I'm going to have you say that 3 times later. Private practice healthcare professionals be more profitable by fine-tuning the patient experience. And y'all know with G&A Consult and what I do, patient experience is everything. So we're diving deep into that. So brace yourselves. She's created systems and strategies to remove some of the most common barriers to healthcare, patient anxiety being a huge one of them. Jessica has also been involved in leadership positions for 2 regional networking organizations for the past 10 years and has empowered over 90 business professionals to thrive and become more successful. Jessica, welcome to the Toot Sleuth podcast.
Thank you, Greg.
Yeah, I'm so excited to have you here. I like patient experience. That was a fun tongue twister. Thank you for putting that in there. And I know my producer is not going to remove that part from the program, which is even more fun, right? So tell me, like, patient experience for me, I talk about it, I speak on it. I think it's a really broad topic, so we can certainly go in a lot of different directions with it. So when you talk about fine tuning the patient experience, let's use that as our leaping off point. Let's talk about that a little bit.
Yeah. So I think a lot of teams think they're doing a pretty decent job, and they probably are. But I don't think enough attention is paid to all the details. There are so many things that when a patient, especially when they're new to a dental practice, that they're absorbing all these little details from getting out of their car, walking in, that first greeting, looking around, the smell, the sounds, the clutter. I mean, there are a million different details that we could talk about that the patient is absorbing within the first few minutes of even entering a dental practice. Now, we're not even talking about phone calls and things like that. That's a whole other piece of it. But I don't think enough attention is paid to those details. And that's unfortunate because the patient is making judgments based on those details. And they have so much choice, right? Patients have so many opportunities of where to go and who to be loyal to. And so if we can really hone in on those details and appeal to the emotional piece for patients of how they feel. What does it feel like to be a patient in this practice? What does it feel like not only to just check in and, get appointments booked, but to receive the dentistry? That that really can go a long way in terms of their case acceptance, their willingness to say yes to the treatment that they need, their willingness to spend money, their willingness to refer friends and family. It really can impact everything. And so I love to hone in on all those details of the experience.
Well, you're landing somewhere that we talk about all the time at G&A Consult with our full arch clients, and it's look for and listen for the feelings behind the facts. If you really want to get into that emotional connection with patients, it's certainly the facts are important, and that touch point, that first touch point in the patient journey, even before getting to what you're talking about, which is once they get in clinic, it's that first touch point, that initial inquiry that a patient has to a practice. And that is what that first sound, right? How do you sound? And that's having empathy. And so bringing that forward, I think, is so critically important. Right, the facts are important. Right, I have a toothache. I need a cleaning. I haven't been to the dentist in X number of years. I'm missing teeth. Whatever those facts are is one thing, but the feelings behind it and trying to understand that's where you can create empathy and the emotional connection to be able to actually start to earn and build trust with a patient. So, and I know that was a lot that I just gave right there, but that's so critically important. One thing though that you said that I want to hone in on, and I think I don't want to say it's a big miss with a lot of practices that we work with or that I'm aware of, but my friend Suji Park, and this is her line of business, and she does signature scents. And so it's the smell, right? Because patients that are new to a practice, they walk in, right? The parking lot's important for sure, but when they first walk into a practice, it's so fascinating that I've walked into literally thousands of dental practices. I've been in the industry for 18 years. I come from the manufacturing side, right? So from sales, I mean, literally, when I say thousands, I'm not exaggerating. Thousands of dental practices. That first smell that you walk into, so critically important, right? And the other piece, I was having a conversation about, like, how clean are the bathrooms, right? How often are they being checked, and how clean are the bathrooms? Because how clean those bathrooms are, a new patient is going to have that same perception of how clean are they going to be with my mouth. So tell me a little bit about, because you said smells, and I'm just curious about, was that just a throwaway, or is that something you've experienced before that you actually share with clients that you work with and have worked with professionals on?
Oh, absolutely. So my husband's a dentist. That's how I came to love the dental field. But when I would just go visit the practice before I was involved on the day to day, I would literally walk in and I could smell that wall of dentistry, and they couldn't smell it. The team couldn't because they're used to it. Their body is desensitized. But our patients that aren't coming in on a daily basis, that they do get hit with that immediately. And that's, I think, what's so interesting about the work that I do and like my background, because as a school psychologist, I think I had a lot of training and a lot of experience in the school setting with sensory kiddos that are struggling with ADHD or cognitive delays or behavioral issues. Their sensory systems are typically, lacking regulation. And so in the school setting, what we do is we have sensory rooms where kids can either go and get less sensory or they can go and get more sensory. And so as I started doing it to our practice, and applying this concept to the dental field. But that's really what it's about, is that when a patient is in our environment, physically especially, their sensory system is working to make those judgments to determine, is this good or is this bad. And now there's all that whole cognitive piece of, well, I heard having a root canal is really terrible, or I've heard really good things about this practice, right? So those things are at play in the background, but that sensory system is working in overdrive when you're trying to initially make some judgments on if something is going to be for you or not for you. And that those are the things we can really control and make an impact on, and scent being one of them. Like, scent is very powerful. If you think of, you can, I mean, all of us right now sitting in our where we are can visualize like walking into a hospital, and we can probably smell what that's like, and it's not good. So we can make that better, and it's so simple.
Yeah, and we talk about it all the time. If there are so many memories attached to smell, right? I think it's called our olfactory sense nerves, right? OLFACTORY. I think like my middle school teachers would be proud of me for my spelling ability, and I never made it to the national spelling bee, but at least in my middle school, I came in like third, I think, in my sixth grade spelling bee. So at least I'm doing someone proud. Uh, and what you described there, though, about the root canal, and we work with clients all the time about helping patients in the fixed full arch, right? The teeth and day all on X, whatever you want to call it, helping patients to understand, right? Because it's not so much the product, right? The teeth that they would ultimately be getting, right? That is important, but it's the why, it's the motivation behind it, and what is preventing them without them saying from moving forward. And a lot of times it's giving them that general understanding of, okay, so what does it look like? What is it going to be like to go through this experience? Because those of us that are in the industry and are in it day in, day out, provide this service over and over and over again. Say, for example, if they're in a full arch clinic, or even if they're doing like 5 or 6 of these procedures in a month, they're so familiar with it that they forget to fill in the gaps or to paint the picture, starting at a very high level, right? Not going into the gory details, but starting at a very high level. If they want more information, giving more information. Like you said, they come in with this perceptions of what a root canal is, of, oh, I've heard it's very scary. I heard it's painful, right? So, removing that barrier and saying, this is what it can look like. The one example I love to give when we're teaching and coaching and training is, a patient will ask, is it painful? Right? and they'll answer with what they believe the answer is, right? A treatment coordinator, a doctor, no, it doesn't hurt them. Everybody's sensitivity to pain is different. Everybody responds differently, right? Well, in general, what most patients experience is some soreness, blah, 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 blah. However, everybody, responds differently to fill in the gap because that's truthful, right? It gives patients a realistic response so they can make the determination. Because they'd be like, yeah, I mean, like for me personally, like I can tolerate some pain, but a mosquito bite, forget about it. Like it will annoy me like to no end and like forget about it, right? So like for example, like my son, like don't don't harm him. Like, don't even like slap him on the wrist. I'd rather have you punch me in the face 30 times. For anybody who has kids out there, no, right? Don't let my child be sick. Don't hurt my child. Same, right? He's 33, by the way, right? And just so well, I can't. I have an announcement to make on the Two Sleuth podcast, but I can't make it yet. So I've been sworn to secrecy. But so it's exactly what you're talking about, right? That perception reality. We become desensitized because we're in it so often. So how do you work with when you're working with professionals that have really become desensitized to? How do you make them more aware of for them to be, I don't want better, yeah, to be better um, in the patient experience, in forward facing, better with their teams and helping their teams to understand, especially when there's multi generational team members from, I don't want to go through, Gen X, Gen Y, all, you could have some 20 somethings working up front or as dental assistants and some of the more veteran team members that all learn differently, understand differently. How do you work with professionals in that way so that they can be more effective leaders?
Yeah, that's a good question. So I do a dental anxiety training with the team to really help them understand the impact and understand, why people are anxious, and what components could be contributing to that anxiety. And I try to appeal to the different ways that it might matter to someone because I understand that not everybody has empathy as a high, area of strength. Like some people are very empathetic and they're like they're going to sit with that patient, hug them, like let them cry, do all the things, and then the next person's like, get over it, you're good. And a lot of people in healthcare do lack some empathy for good reason, right? Like if the doctor was so empathetic with patients, they might not be able to perform their job very
Right.
well. They
Some
not
need
might
to,
not be able to
right?
handle.
Bottom line,
Yeah,
right?
yeah.
They need to be able to flip them over, slap them up, because if not, like they could, flatline on the table. No, I agree with you. Please. Yeah,
Right.
go ahead.
Yeah,
Yeah.
so they need to have a certain, capacity for empathy, but not it's sometimes it's just lacking in healthcare. So I really try to appeal to not only the people that, do have some natural empathy to like say this is how people are feeling and this is how this impacts their daily life, but also here are the financial impacts of dental anxiety and not being able to address it effectively on the business because that appeals to some people. And then also talking through here are the efficiencies in your team and how the your stress as a team member and your cohesion as a team can be improved when you're addressing dental anxiety and helping people to have a calmer, better experience. Like what does that do for you as a clinician, as a member of this team, and how can you really grab onto that and care about it, because not everybody just cares that people are anxious and how to make it better. And then the other piece of it is being on site with the team and really observing them in action. And it's funny because a lot of teams will be like, oh, she's here. Like, we got to be on our best behavior. And it's funny because I'm like, I'm not that type of person that's going to say, you got to get rid of so and so. They're terrible. I mean, that's never the case. It's really my job is to find the things they're doing really well already and really reinforce those, highlight those, celebrate those things so that they realize how powerful that is and go, oh, okay, I'll do more of that. That's great. And then also, of course, find those little things that are easy to tweak that they could make a huge difference for their patients. So I think it's not only like that foundational understanding of all the different ways that the anxiety could be impacting the patient and the practice, but then also really working with them alongside of them to show them what they're doing well and what could be improved. And I think having, owned a dental practice and, worked in a dental practice, I think I can really, relate to a lot of what they're feeling. I'm definitely not a clinician. So that piece of it is not as near and dear to me, but I do think, I've learned a lot from our team, and they're my guinea pigs, right? Like I've gotten to, try lots of things with them over the years and see how it works for them. And so that's been very helpful to kind of have that as a way to, you know, try different things and make sure they're effective.
Well, and like you shared, that on-site reinforcement, working right with the team members, sharing that experience with them, finding the things they're doing well, accentuating them, lifting that up, saying, do more of this is so important. And we do that at G&A Consult. And then finding the areas of opportunity is what I like to call them. And then collectively agreeing on what is it that's most urgent that we work on together, rather than, okay, here's the list of 17 things that you could be doing better, right? The mental beatdown session, and collectively agreeing that this is the way forward, how we're going to work on this, and this is what we're going to work on together. And then putting benchmarks in place together of this is what success will look like, not of, we're going to go from, 1 to 10 in the next 3 weeks. And that's the only way it's going to be. And measuring it. And like you said, for owner, founders, regional managers, if they happen to be a group or a DSO, in our lane, looking at that piece, certainly how it impacts profitability, because it can also not just in the increased revenue, but it can also work in reduced costs, right? Because working more efficiently as teams. So I can appreciate that you bring that out. One thing that we're constantly dealing with, right, is that concept of change management and resistant to, a good friend of mine, Chelsea Myers, likes to frame it as some people are just in a deep sleep and they really just don't want to change. And that's okay. It doesn't mean you have to force them to. But those that really do want to change, there could still be some resistance to, right? Oh, well, we've had consultants before. We've had people who come in before, right? That the comment that you made when you walked in is like, oh, she's here, right? Or he's here in my case, or any one of my team members that go in and help these practices. What do you find have been one or some effective methods to overcome that resistance, to really get down to the work, right? To be able to find some improvement with teams in a collaborative way.
Yeah, it can be tricky. And I was just out for margaritas last night with some ladies, and one of them was an eye doctor, and she was expressing some, some frustration with team. And the other gal was a chiropractor, and she goes, "Gosh, you guys talk about team all the time. Like, I'm not going to hire people. It seems like that's a headache." And I said, well, it can be. It can be one of the hardest pieces of owning a business and managing a business is the people, because they're not robots. They have all their own feelings and desires and, things that they want to accomplish. And they're creatures of comfort too. So change can be really hard. I think it's finding the cheerleaders in the practice, the people that are excited to change, and really rallying with them to show how the change can be positive. And then the people that are maybe more reluctant, really trying to understand what is the reluctance. Why is this tricky for you? Is it that you feel that you don't have time? All right, let's look at what does your time look like, and finding ways that it can be incorporated in efficiently so that it doesn't take them more time, or doesn't feel like it takes them more time. Um, I actually work alongside with Dr. Matthew Norton, who introduced us, because there are some teams that are just not cohesive, and where that has to be really central before we can do a lot of this change. And so him and I actually work with a lot of clients together, because if when he does his magic of helping them understand themselves and each other better, and want to work in the same direction as a team, now we can get on the same page about change. If we don't have that piece, it can be really tricky. Sometimes it's just one person. I can remember one of my clients years ago had a hygienist who had been there forever, and she sat through my spiel. We talked about all the things we were gonna bring into the practice, and details we were gonna add in that were gonna be amazing for patients, and everyone was excited except for her. And she just sat there and she just shook her head the whole time. And at one point she asked something, and I gave her a response of how to handle it. And she said, well, I'm not going to do that. And I was like,
Mm.
oh my word, like here we are going
Just the
head to
flat
head.
out denial of no.
Yeah,
Yeah,
not
the
gonna do it in
resistor.
front of
Yep.
the whole team, in front of the 3 doctors, and I was just like, "Well, that's between you and your management team, but, the rest of the team's on board and, you're." So what ended up happening was she retired shortly thereafter, which was a good thing. Everybody was like, "Yeah, it needed to happen." So sometimes, I mean, I never wanna be like the the person to come in and ruffle a bunch of feathers or anything. I'm always wanting to work with teams collaboratively, like helping everybody to be their best selves for the patients, for the practice to be amazing. But sometimes that happens and people aren't in the right position, or they're not at the right place, or they're just done. And that's okay too. If you have team members that aren't willing to get on board with your vision and move the practice in the direction that it needs to move for the betterment of everyone, then those are tough calls. But yeah.
Yeah, finding the champion in the practice is so critically important, and we find not only for to be able to move initiatives forward, while we're there, but also because we go in office once a month, what's happening the other 18, 19, 20 business days, if they're open Monday through Friday, of course, or the other 15, 16 if it's open, 4 days a week when we're not there. Right. We do virtual trainings every week as well, and do the virtual strategy sessions as well, but we're not feet on the street every single day like that champion or champions are. And so getting that feedback and learning from them what they're seeing, feeling, tasting, touching, just like the patient experience, to go back to what you said, right? Smelling, right? What is really going on during those interim pieces help to get the momentum and progress forward so much faster, right? And the stickiness to it, to the changes that you're trying to make. If not, it's 2 steps forward, 3 to the side, one back to the other side, and one back. And I mean, it's just shuffling pieces around the board rather than making sustainable progress. And there's nothing more frustrating for us when we're not seeing sustainable growth overall. It's okay if there's setbacks, but to not see sustainable growth overall. So I appreciate you lifting that up. All right, Jessica, here's the part of the program. All of our guests play a little something called What the Sleuth is Going On? 3 rapid fire questions. First thing that comes to mind, are you ready to play?
Yes.
All right, question number 1. What's the worst bad breath you've ever encountered?
Ooh. I'm not a clinician, so I don't get all of the gnarly things that happen in the back. Thank goodness, right? For me. But there's one scent breath wise that really gets me, and it's onion, like green onion specifically. And it's not even just the breath, it's like the whole body is just emanates, like it comes through the pores, and it's just nasty. So I would say green onion.
Okay, green onion. So I'll share with you. I'll take a little sidetrack here. So we're coming up on our 100th episode, and we're putting together like all the responses of all of our guests over the 100. I think green onion. I think that is a unique response. So
good.
well done. I could be wrong. My producer Murphy will tell me later for sure. Okay, question number 2. If you could change one thing about your smile, what would it be?
I would say whiter. I do not like whitening my teeth, and I have all the products at my disposal, right? Like I could do it anytime. But my teeth get really sensitive when I whiten them, and so I just don't. But I want them to be white and beautiful.
Like seriously, people, I understand like the concept behind teeth whitening, okay, but for people like I don't want anyone touching my teeth first and foremost, right? But what's with the sensitive? Could somebody just figure this out? And people, jokingly have said, well, let's just get veneers. And it's like, no, like I like my teeth, like, but just figure it out. I do the at-home stuff. I've tried just about every product on the market. Plug here if somebody wants to come and sponsor the Two Sleuth podcast and like send something free to me. But I've tried just about all of them. And yeah, so frustrating. I mean, your smile is beautiful. By the way, that timestamp at like 23 minutes maybe-ish. So go over to the YouTube channel, check it out, like, subscribe. shameless plug for the Two Sleuth podcast. All my regular listeners know, and they'll blow me up on socials on that too, Jessica. So they'll probably tag you on it and be like, seriously. But yeah, go see her smile. You
They
have a
could
beautiful
be whiter,
smile.
but I also,
Yeah.
it's not just the sensitivity. I hate having the goop on my teeth for even like 20 minutes. It just feels like a lot. I just don't want it.
It's a lot. So I do the strips and the ultraviolet light, like the at home thing, and it does make a difference for a short period of time. And it's like a thing. And then my dogs like look at me like, "What is coming out of your mouth? And what's that all about?" And my one dog like wants to come up and like lick my lips, and it's like, "Come on, guys, what's going on here?" I think they're just expressing love, and literally he's like right here in my home office looking up at me as I said that. He's, it's a puppy. What are you gonna do? Okay, question number 3. We're getting off track. It's on me. It's on me. But my listeners know what happens. If question number 3, if you could go back and be the inventor of any dental product, and no, you can't choose your own if you've invented something, which one would you choose and why?
Uh, the first thing that comes to mind, even though I don't use it myself, so it's really silly, but Cocoa Floss. I think like it's cute, it's boutiquey, I like their style, their brand, and it looks like a company that you could like use your creativity with. So I think that would be a fun one. I don't use it myself because, well, I'm married to a dentist, so he brings home like the spools of floss that we put in the big. Anyway, I'd say I can't go to the dental aisle at the Target and buy anything because like I can get all of that, so I don't get to pick out my own stuff. But I think it's a cute company.
So we have good friends of ours that are both dentists, and we vacationed with them fairly recently. And on vacation, he forgot to bring a toothbrush, and he had to go and buy a toothbrush. And he came back to the place that we were renting, a Verbo, and he's like, "I think that's the first time I bought a toothbrush in 25 years." And it was just comical to me because I'm like, well, yeah, I guess so. If you're a dentist, you would just like go to your supply closet and grab one. You wouldn't really buy one. And
No,
then I
you don't
thought,
go in the
wait,
aisle.
you don't have an electric toothbrush? And then I thought, no way, because I think they probably sell them at the practice. He's a general dentist that does a lot of specialty as well. So yeah, it was just an interesting thing. And I thought, yeah, I guess you never have to, would you? Interesting. So anyway, well, Jessica, I want to respect your time and my listening audience and keep this like under 17 hours. I'm not Joe Rogan, I can get away with that. So is the last few minutes, is there anything I haven't asked you or anything you just dying to get off your chest for my listening audience to learn about you or what you do?
Well, I would say that when I help practices really dive into the details and make a more amazing patient experience, what has resulted for a lot of my clients, and now I do this as well, is helping them get out of insurance networks. Because when they do it better and different, they become like this magnet for people that really love what they're doing. And so now they can make decisions like getting out of network and raising fees and doing things that are really good for the business side and retain their patients. But it has to be done. It has to be done thoughtfully, and there's financial impacts. There's marketing things to consider. There's a whole component of it, and so I love helping practices really do that gracefully, take that big leap away from dental insurance gracefully, and retain as many of those patients as possible. So yeah, we didn't get into that, but I think that is a fun side effect of being exceptional at what you do and standing out in the crowd.
Yeah, certainly. If you're going to work on patient experience, being able to transition to fee for service and working in the full arch lane like we do at G&A Consult with our clients, it's fee for service for the most part. And so that definitely resonates with me. My guest today has been Jessica Martin, and she is a dental practice co-owner and helps practices, business professionals to thrive and become more successful. It has been a delightful conversation. And Jessica, if people want to get a hold of you, what's the best way to do so?
Yes, they can go to my website, which is martinmanagementllc.com, or they can just email me directly, Jessica at martinmanagementllc.com.
Excellent. And we'll make sure we get all that in the show notes. It has truly been a pleasure. Thank you so much for being a guest on the Two Sleuth podcast.